Hi, this is Yazdabul, live from SCAI 2019. I'm pleased to be joined by Dr. Gilchrist and Dr. Arnold Seto. Thank you both for joining us today. And we're going to talk about the Transition for Value program. Dr. Gilchrist, tell us a little bit more about the challenges and some of the barriers that impede clinicians from transitioning from a femoral approach to a radial approach.
Well, one of the problems physicians have is changing their approach to practice, and especially if they've been trained in their fellowship or been doing a certain type of access for a long period of time and they feel that they're successful at it, they're very concerned about changing their practice patterns. And Transradial is a change in your practice pattern, and for those that have been used to a femoral approach, this is new, and it raises their anxiety, it raises their concern that they might perhaps fail or otherwise not be as good. And so this is part of a series of things that we've done to try to show the practicing physicians and others that are interested in learning that Transradial really does have a value compared to their more traditional femoral approach.
And overall, what's the trend been? Have people been more accepting of the radial approach? Has it become easier for clinicians to transition, or are you still finding there's difficulty?
Well, if you look around the world, Transradial is growing. Some countries faster than others, but there's no situation where Transradial has grown and then regressed back down. So it's a trend that is continuing to go up, and it's just a matter of how quickly are people getting onto the radial boat. The boat's going to be leaving, but it's whether you're going to be the last man on or you're up there in the front.
Dr. Seto, tell us a little bit more about the Transition for Value program.
Yeah, so I mean, just dovetailing with what Ian was mentioning, I mean, in the US now we're doing 40% radial PCI, and so that trend has already taken off in the US. It's still accelerating, and it's not showing any signs of plateauing. So I think people are already achieving this transition, and SCAI is really trying to empower people with the tools that would make it easier. Everyone has resistances. Even in my Los Angeles area, the uptake of radial has been relatively modest, mainly because of staff and physician resistance. So the SCAI Transition for Value approach is a series of lectures online narrated by Adir Shroff and Snow Rao, at least so far, and then sponsored by Terumo, Medtronic, and CSI to really go over the barriers that impede one's progress along the radial curve and step by step go over how to overcome them. And that includes staff resistance, it includes getting the right equipment, it includes getting your own training, getting over that learning curve, expecting the learning curve, expecting the complications, expecting and anticipating what you're going to find on the other end, and then reaping the rewards of patient satisfaction, improved discharge ability of patients, and overall fewer complications. Most importantly, perhaps, is just measuring the outcomes, measuring how frequently you're able to discharge people the same day or the next day, measuring the patient preferences. This is how you can collect those positive results from a transition and then show it to yourself, the staff, and to your administration to show that this transition is worthwhile. In terms of the Transition for Value, the next steps from this lecture series is to include potentially how do you transition to the next level of getting Transradial for your STEMIs, where we know the value is the highest for mortality reduction. Similarly, can you use the Transradial approach for the secondary access for CTO interventions, or perhaps a biradial approach for TAVR as well. And then finally, expanding our operations, the offerings for the cardiovascular professional. How do you maintain patent hemostasis, get your nurses comfortable on the floor, really reaching out beyond the physician, but to the staff as well about how to manage the radial patient.
And in terms of logistics, how can people apply to the T4V program, and how many modules are they expecting? What kind of time frame?
Great question. So the modules are about 8 or 9 of them online right now, and it's an online lecture that's narrated by their voices. It's available online through the SCAI website at this point, through the SCAI. It's still beyond a firewall, but I think it's going to be more and more available, and hopefully it's going to become downloadable in terms of videos in the future.
Dr. Gilchrist, what do you think the next steps are in terms of transradial approach and how we can expand the knowledge and disseminate that knowledge?
Well, I think a lot of our effort right now has been with the physicians. I think making sure that there is understanding within the technical staff that we work with, so that the physician isn't the only one teaching people how to do it, but that there is a core understanding. Radial now is being looked at for all sorts of non-coronary use too, for carotid stenting, for peripheral vascular work. There's tumor embolizations now being done transradially. All these fields that traditionally used a femoral artery access have the same complications that we had as cardiologists using the femoral artery, and they can all benefit from a transradial approach. And I think that's a whole nother field that's growing, and perhaps we can work with some of these other groups, some of them clearly outside the usual scope of SCAI, but we have a nice resource here that might be helpful for anyone that's interested in radial access.
Well, thank you both for your input, and thank you all for joining us live from SCAI 2019.